Is it okay to water fast if you have amalgams? And two, if you have cysts or polyps and you're already low weight and go on the vegan SOS, is there a chance of resolving those without the water fasting?
Well, yeah, I mean, the body health results from healthful living. So you do diet and lifestyle change, and oftentimes conditions will resolve themselves. If they don't, then we can turn up the heat a little bit by using water-only fasting. That's why they call us True North Health Center, the last resort. As far as amalgams, amalgams can be a source of mercury, low level of leaching. So I would recommend, if you're having new fillings done, there's better materials to use and less toxic materials. I wouldn't take completely stable fillings and recommend you rip them out. You're probably going to get more exposure in that process than you would even from the background exposure. But as far as the reason why some people get better when they've had amalgam fillings removed, it may not necessarily just be mercury, but it's also because old fillings that are breaking down often have decay associated with them, and that's an infection. And so sometimes just cleaning up the old decay can be beneficial. And certainly if you're removing deteriorating filling, you want to replace it with some of the newer composite materials that don't have the toxic thresholds that perhaps the older, cheaper amalgam fillings had.
Yes, how safe is this program for children with obesity and high blood pressure?
Well, it's just the same adaptation in children as it is in adults, and it works just as well. It's just that the one thing with children you always have to be cognizant of is hydration. Small children are much more vulnerable to dehydration than adults are, so the level of monitoring that's necessary is high. It's not something that we recommend doing water-only fasting with children, except in a controlled setting. The good news is kids are also usually not as toxic as adults, because they haven't had as many years of abuse, and so diet and lifestyle change alone are usually sufficient to allow the process to turn around. If you can get and induce the necessary dietary changes, it becomes less necessary to go through the more vigorous process of fasting.
Hi, okay. You speak about a 40-day fast, water fast, a 21-day water fast. These are people who have eaten every day, all day. How do you wean, or what do you suggest people, how they can get on this fast, water fast, without stopping it?
Right, so what we do is we have people lead in as much as possible with a whole plant food SOS-free diet, and particularly the 2 days before arrival or the first 2 days at the center, we're eating exclusively fruits, vegetables, raw and cooked, and no meat, fish, fowl, eggs, dairy products, oil, salt, sugar, coffee, alcohol, or anything else. Basically, we tell people anything that you might possibly want, you can't have. You get nothing. And then afterwards, we ask people to comply with the whole plant food SOS-free diet, not forever, just for 50 years. And once we get our 50-year follow-ups, then they're free to do whatever they want. In fact, recently I got a gentleman who came in, it had been 30 years from his original visit. He came in at 55, and now he was 85. When he was 55, he was a carpenter. He had trouble at that time with his shoulder, so he came to see me as a chiropractor to see whether or not I could help him with his shoulder, because he couldn't paint the ceilings. And his kid was in his crew and had to paint the ceilings for him. And I said, well, first you'd have to quit smoking, you'd have to quit drinking, you'd have to give up all your meat, fish, fowl, eggs, dairy products, oil, salt, and sugar. And he said, well, I have to do that forever. And that's the first time I said, well, no, of course not. It's just 50 years. And he said, you think you're funny, don't you, Doc? And I said, yes. I cracked me up. But anyway, he did it. He actually quit smoking and drinking. And I worked with him, and it's been a long time. I lost track of him. So finally, he shows up in the office. It's been 14 years since I've seen him. And he comes in for a checkup. And I said, what's wrong? He says, nothing's wrong. He said he thought it was time for a checkup. I said, how are you doing? He said, I'm doing fine. He said, this diet you gave me seems to be working. He said, I'm still working. He's 85 years old. He's still painting. I said, that's fabulous. And he said, yeah, all my crew is dead. And my son is dead. 60-year-old son died of a heart attack, not doing the diet. I said, I'm so sorry to hear about your son. He said, it's okay, I do the ceilings myself now. I said, are you telling me that arthritic shoulder got well? He said, well, not so much, he says, but I got an airless paint sprayer. He made another appointment in 14 years when he turns 99. And he told me that if anything comes up before then, he'd let me know.
Hi, I had a question about dietary, like all these dietary changes affecting like our bone health, for example, scoliosis, hunchback, pinched nerve. Does it have any effect on those type of things?
Well, yeah, that's a lot of different conditions. Some of these problems are mechanical. Mechanical problems will approach mechanically. If you have a broken arm, we're going to get you to do a cast or appropriate reduction. If you have, spinal problems, we're certainly not against the use of manipulative therapy and physical therapy and exercise and all of that type of stuff. Where fasting comes in, and it's very powerful, is reducing inflammation. In fact, the chiropractors that work at the True North Health Center, and we have a number of good chiropractors, we joke amongst ourselves that you better treat people right away. Because if you wait till they're done fasting, there may be nothing left to do. Because so many of these chronic pain problems go away before we ever even touch people, just from the reduction of inflammation, the rest, and that type of correction. But there are problems that people have. They get hitches in their giddy-ups, and sometimes manipulative therapy, functional movement screening, exercise, these things that we do externally can be a helpful tool. But certainly they're much more effective in a healthy person eating healthy than they are in people that are toxic waste dumps.
Yes, hello. I'm wondering, everybody says that you need good sleep. Does the water fast help at all with insomnia, depression?
Well, during fasting, it can be a bit disrupted because your brain changes from burning glucose to burning ketones. And I think your brain is saying, what the heck are you doing? Go get something to eat. But after fasting, even chronic problems are oftentimes corrected. People that have sleep apnea, oftentimes the weight reduction and the inflammation reduction is successful at helping them, in some cases, even eliminate the need for their CPAP. Patients that have had many times some of the psychological distress that people experience is because they feel out of control, that they have irritation in their nervous system, and many times that is corrected. So the sleep that comes as a consequence of getting healthy oftentimes is profoundly improved. It's also important for people to know if they want to sleep well, they need to sleep in a cool, dark, and quiet place. They need to set a consistent pattern. It helps to deal with the psychological issues, many of which are aggravated by their poor diet and lifestyle choices. So I'd say that the answer is that indirectly, yes, although again, short term, sometimes those symptoms are even worse, and then long term, they get better. You really have to have a long-term perspective when you're thinking about allowing the body to heal itself, particularly for people that have invested months or years in getting themselves sick. Sometimes it can take a little bit of time for the body to completely heal itself.
Yes, I'd like to ask about the water, particularly the water diet. Is there any particular water? Does it have lemon in it? Is it core water? Is it,
Yeah.
is it
So,
fresh water, tap water?
We use fractionally distilled water, so it's H2O. So there's no alkalinization, there's no additives, there's no magic. We don't bend the water a certain way. We don't have to use any special intervention. You could also use any highly purified water. You could use reverse osmosis. You could use any highly purified water. It's just that during fasting, people become extremely sensitive. And if you give them municipal water with all the hydrogenated halocarbons and the chlorine, they don't like it, they won't drink it, you end up with hydration issues. So we actually have a lab-grade distiller that takes the water down to just pure H2O, which is essentially what rainwater would be if we had a clean environment for it to fall through. And that's all that we're looking for is actually water. As far as drinking water, again, any highly efficient system would be certainly an effective source for your drinking water. We use distillation because it's probably the most effective, but there's other filtration systems that can work as well.
To follow on that a little more, many people have a hard time just having a water fast. And there's something called the fasting mimicking diet,
Yes.
in which you have soup and other things and lower amount of calories. How do you know if you break your fast with something like that?
Yeah, so there's some a wide variety of programs out there, not what I've been discussing today. Perhaps they'll have me come back another time. We can talk about fasting mimicking diets and alternative stuff. That's really not my focus of topic. However, if you're interested, you can go to our website, healthpromoting.com. We have a number of articles all freely available, including our version of an interpretation of the fasting mimicking diet research. I'd also like to mention, if any of you are interested in knowing whether fasting might have utility to you, we do offer a free service. If you go onto our website, healthpromoting.com, download the registration forms and fill that out. It gets me your medical history information. You can call without cost. I'll be happy to talk to you and give you my best insight into whether or not fasting may have some utility for you. Thank you very much for your attention.